Thank you very much, Bernard Okumu, for that comprehensive coverage on what has been happening in the sporting arena. And it's a sad night for Manchester United fans, but nonetheless, we live, right? Now, we shift gears and talk about matters of reproductive health, and we have a keen focus tonight on the latest report by none other than the African Population and Health Research Center. And tonight on my set, or rather on the set tonight, is none other than Senior Research Officer, that is Kenneth Juma, to take us through this conversation. Tonight, we're looking at a situation, induced abortion crisis, and we're going to try and unpack that particular report to look at what has been happening. Thank you very much, sir, for your time.
Thank you.
Let's start off. Do you think we have an induced abortion crisis, in a nutshell?
Thank you very much. Again, my name is Kenneth Juma from the African Population and Health Research Center, and very excited to be here. Indeed, I would characterize the challenge as one of a broad sexual and reproductive health challenges that affect a range of, both adolescents, young adults, as well as, older people. So it is not just a challenge that we want to narrow down to probably young women or young girls, but rather a broad spectrum challenge around sexual and reproductive health issues in the country.
I like the broad spectrum aspect, because I want to pick up, or rather pull up, some of the reports that you made public in the week ending today. And I'm going to be looking at the key findings. One that indicates that more than half of the women were currently in a relationship at 58%, and had completed secondary education or higher at 56%, and at one point had a child, that is at 69%, and had one abortion in their lifetime. That represents around 82% of the sample size that he had. What can we, say about that particular finding?
Yeah, so what we found, and I would like to recap a little bit about the study. So the study was done in partnership with the Ministry of Health, as well as the Guttmacher Institute. And our goal was really to estimate the total number of induced abortions in the country, the severity of complications that result from abortions, as well as the preparedness of health facilities to provide post-abortion care. Indeed, what you have cited is not really the breakdown of population among those who sought abortion, but rather the breakdown of population by those socio-demographic characteristics among those who sought care post-abortion.
Post-abortion.
So it is not those who induced abortion, and that is, I think, an important clarity, because what has gone out there is that 80% of married women are the ones seeking abortion. I think that is a position that is incorrect.
Then let's unpack this, because from where we got that particular report, we did not know the details, and that's why we are having this particular conversation.
Absolutely.
Because then there's a question of miscarriages and such. So there are other factors that are leading to this particular statistic, as it were, or other findings. So from where you sit as a lead researcher, what would lead us to get these findings?
Okay, yeah, so when you look at the challenge of abortion, abortion is sort of the outcome of a pregnancy. And what we cite in our findings as the leading driver of abortions, the numbers that we cited, is really an intended pregnancy.
Unintended pregnancy.
Unintended pregnancy. And then the question is, what causes unintended pregnancy? Unintended pregnancy is mainly driven, again, by sometimes lack of access to modern and effective contraceptives, or sometimes the access is there, but rather people lack awareness and education around the need and value of modern and effective contraceptives. And when women are in the context of marriage or sexual relationships, without the protection of contraceptives, then the occurrence of a pregnancy is possible. And when that pregnancy is unplanned or mistimed, then we actually refer to it as unintended. So unintended pregnancies are the leading drivers of
unintended pregnancies. Now let's look at the figures. We have around 12% of the sample size saying that they could not access the contraceptive methods, while 16% it was a personal preference not to use contraceptives. But then we also have a curious case of a 16% representative saying that husband/partner opposed the use of contraceptives. In the 21st century, we're still dealing with that. How do we go about it?
That is unfortunate, and thank you for raising it. From our data, we note that a good number are opposed to family planning methods, and this can be linked to a range of sociocultural dynamics, people's feelings around contraceptions, the labeling around use of family planning or contraceptives, and also sometimes a lot of misconceptions and myths around around family planning. People citing consequences that are linked to the use of these family planning methods that sometimes are not true. Some experiences are true and need to be checked into, but others are more broad misconceptions around contraception. So our data details a huge proportion of women who are simply opposed, and those could be linked to fear of side effects. Again,
we'll get to that. I want to look at the aspect, we're looking at this family setup. The partner stroke husband has opposed to the use of contraceptives and such. And then I bring up the question is, what is the role of the man when it comes to family planning?
Thank you. The role of a male partner is important, and that must not be not be emphasized. So in most cases, men can act as supporters, providing resources to access these services. Men can also act as moral supporters, enhancing the women, enhancing the ability of the women to be able to seek and access these services. And also, it removes the idea of stigma and myths and sometimes labeling that partners may have around their female partners if they're using a method that they do not endorse. So male support is really important. And so part of the things that we normally advocate for is male engagement, so that this is not just a female issue, but rather, both partners really being, there to support each other, because there are also methods that are for men. However,
you've brought up that question, and I'd want to know from your sample size, those women, 16% who opted not to take contraceptives, while their partners taking contraceptives. You can have a conversation, hey, I'm not willing to get into contraceptives because of 1, 2, 3 reasons. Would you be willing as a partner? Was there such, an outcome of some cases in the sample size that you sampled for this particular report?
Yes, so the question we asked was, were you using a method of family planning as of the time you got pregnant, the pregnancy that led to the abortion? And when we were asking them the reason why they were not on any method, then they would say their partner is opposed. So this was self-reported by the women who are not on any family planning method. Now, we did not go further to sort of interrogate why the men are opposed, but we would assume that it's the general reasons why some male partners, again, it reflects on the lack of engagement of men, focusing family planning services and programming towards women. Yet I think it's a couples issue, and both couples need to be involved.
All right, that is a gap that we need to look at in as far as value within the value chain. Now, 24% of those you sampled are under the infrequent sex or those who are unmarried. And also further in this particular report, it indicates that this demographic, the younger generation, is using, the numbers have reduced of unwanted pregnancies. It seems that the younger generation now is practicing safe sex. Yet we have 24% here who are, not using contraceptives.
So the general trend is that unintended pregnancies have indeed reduced compared to 2012.
The younger generation, yes.
So among the younger generation, perhaps again it's the efforts by stakeholders to improve access, especially to the young people, which is, I think, kudos to all stakeholders involved. However, there's still a huge gap. When you look at our Kenya Demographic Health Survey, the proportion of unmet need is highest among younger adolescents and young people, meaning that it's unlikely, for a young person below the age of 18 who is sexually active to be able to access an appropriate method of contraception, even if they wanted. So that's a gap that remains, and I think those are some of the missed opportunities that as stakeholders within the health sector need to address to make sure that we seal the gap in terms of pregnancies that then become unintended and may result in induced abortions.
Another finding for this particular report, which really piqued my brain, is that 31% of your sample size did not think that they could get pregnant. Now that is a glaring issue there, because if you're having unsafe sex, I mean, the result, if it's not a child, it's a disease.
Yeah. So again, I would like to contextualize that response. Did not expect to to get pregnant to a number of issues. One, it could be that they do not have stable partners,
All right.
or that they're not in a formal marriage, or that they do not expect whatever happened to happen at that time. So again, it's a cluster of issues that may have sort of made them feel like they're not at risk of pregnancy. And again, also it's also about information and awareness. We do know that there's very limited information and awareness among, especially the young people. They grow up, in a very vulnerable situation, but with very limited protection in terms of education and awareness. So this sort of a response may be emanating from that group of people who are not very aware about their personal sexual and reproductive health positions and the likelihood of a pregnancy occurring.
All right.
Yes.
Now the hugest number is at around 42% who said they fear the side effects, or rather they have concerns over the the contraceptives that are out there, family planning methods. So a clarion call to those who are in this particular, as a lead researcher, what do you think we need to do?
There's value in really strengthening family planning counseling and the comprehensiveness of the counseling, and making sure that we match the family planning or contraceptive product to the fertility desires or intentions of the client, because there are a lot of disappointments sometimes that emanate from mismatch of someone's intentions vis-a-vis the method that they are, that they ultimately take up. And so when that mismatch occurs, you tend to find people reporting outcomes that they see as side effects, but perhaps it was an issue of proper counseling, comprehensive counseling, as at the time of being given the method. So then word spreads, blanketing negativity around family planning, as a programming area, sometimes really anchored on that lack of proper counseling and matching everyone's product to their fertility intention. So if you intend to get pregnant in 2 years, of course there's a method that works for that. If you intend to get pregnant within this year, there's also a method that works for that. So that matching and proper information comprehensively delivered in a language that is understandable to all the clients, I think would address that part of people fearing side effects.
Abortion is illegal in this country, and maybe
Absolutely.
it is also working to counter, access to safe abortion, so to speak. Though the numbers are very, you cannot compare the 72% to a medical or medical abortion or the manual vacuum aspiration, which happens in a medical facility. 8%, 72% would say, the monitored process is winning in this. But then again, the aspect of it being an illegal procedure, how then does it, affect the whole spectrum when it comes to induced abortions?
So, well, I would like to correct the statement that abortion is illegal. Abortion is legally restricted.
Legally restricted, not illegal.
Not illegal.
Legally restricted.
Legally restricted, which means it's allowed under a limited set of conditions, including in the opinion of a health provider when there's need for emergency care, or if the health or life of the woman is at risk, or if deemed necessary by any other trained professional. So it means there's an open
deemed
window.
Necessary by any?
By a health professional.
By a health professional.
Absolutely.
Yeah.
So because of that, then there are opportunities to access safe abortion, including sexual violence, for instance, right? However, because of these restrictions and limitations, and we know our penal code, which is, dated in the colonial era, also criminalizes abortion. So it creates a condition where both providers are fearful, women are also fearful. There's a lot of community stigma. So it leaves women in a situation where they have to resort to clandestine yet unsafe methods. Okay, so even the manual vacuum aspiration that is cited in our report, which is a surgical procedure, certainly perhaps is not offered in public facilities. It's perhaps only offered in private settings, and the medication abortion is sort of the opening window for women.
Now that is where I was getting, because at a cool 62% is actually opting for this, and I'm wondering, at some point, we'd had a report that had also documented there being a prevalence of over-the-counter medication to terminate pregnancies and such. Medication, and how are we regulating this? You've said it is not illegal, but then it's shrouded in some areas with a lot of, it's a gray area, so to speak. Yeah, pro-life, pro-choice.
Now, I think I would like to sort of restructure the question to more of how do we protect the women?
Indeed.
from the very unsafe abortions that perhaps occur that then threaten their lives,
yes,
and health and well-being. And not only their health and well-being, but rather both the immediate health and future well-being, ability to be constructive members of the society. So one of the main efforts really is to reform our laws to be able to allow, at least within legal provisions, abortions that should be done safely, because it's safer and cheaper to provide it safely for those that are legally entitled, as opposed to allowing women to then do whatever they want and then they still end up in our public facilities, public and private facilities for care. And that post-abortion care is legal and will be provided, but at a very costly price. So I think the choice we have as a country is to have a thorough debate around this very sensitive topic, and to discuss it with a lot of objectivity as to how can we reduce the harm that is leveled to women and girls, and also, to basically protect them. Yes.
So from a professional point of view, and also your opinion then, is there a yes or no to abortion? It's quite a controversial conversation. Have we come of age to, abortion itself, it's somewhat taboo, as we call it, other than the legal aspect and such.
Yeah.
So on a professional point of view, what is your take on that? Because that's the question we've been asking some of our viewers, and I'd want to sample their views as we bring this to a close. What's your take on abortion?
Thank you. So I'm sort of privileged to give that answer. However, from our research really, and this is not a personal opinion, each case of abortion has a very intricate story behind it, and that when you don't understand, then you may never know why they made the choices they made. So sometimes people's opinions, even my opinion, shifts depending on which situation I am in. If it's your sister, your answer is different. If it is your daughter, your answer is different.
Yeah.
If it is some unknown person out there, your answer is different. So again, that's why I say that the answer to that question sometimes is very situational.
Is fluid.
It's very fluid.
Yes.
And depends on the person that is wearing the shoes.
All right.
Yes.
Now, from your sample size, maybe you give us what those who had actually gotten abortion aftercare within the relationship setup.
Absolutely.
What reasons did they give? Because when you look at the report onset without looking at the nitty-gritty details as you have unpacked, you'd be wondering, the person who's already had a child, a person who's in a relationship, and someone who is married should be open to having more children.
Yes.
But for them to be procuring, it's a misnomer.
Yes.
So
sure.
what reasons were given?
Thank you for that question again. I think first of all we start with this group called married.
Married, yeah.
Okay. The clarity that I should bring there also is that sometimes we marriage, that those who are formally married with a certificate that formalizes that marriage.
Yes.
But then there's also a huge group of women who are just living together with a man. When you ask them, are you married? The answer is yes, but it's not sort of formalized. So getting back to your question around why abortions do occur among this category of women, it's the same reasons across various groups, that there's the general pressure to have fewer children. It's a demographic situation. Number two is that there's also a general pressure to delay the onset of giving birth. There's also the general pressure to have smaller families. So all these issues put together, so I normally say our parents had more children than we'll have, and our children will have fewer children than we have, sort of reflecting that natural pressure that occurs around having fewer families. So I suppose it's the same reasons that also is reflected in these groups of women who perhaps have had a child and they don't want another, or they've had two and they don't want a third one, or they are pursuing education or career, and so they feel they're not yet ready to begin that process. So again, the reasons vary a lot, and again, as I said, it's sometimes very personal for each and every person.
All right. Yeah. Maybe you can respond to this few responses that we've gotten on X. Thank you for reaching out. There's Stanley J here who is saying, so we asked them, what is your take on abortion? And his response was that it is a pregnancy prevention method. What's your take on that quickly, Kenneth?
Thanks, Stanley. I would say, again, that's his opinion, and I'm sure everyone has an opinion.
Everyone has an opinion. Yes. Now let's listen to Felicity Mwandwa, who says, getting pregnant when I'm not ready for a child is not something I'm ready to go through with. Yes.
Yeah, I mean, it's good she's aware.
Yeah.
And it's good that then she puts all measures in place to prevent the occurrence of that unintended pregnancy in the first place.
So last but not least, okay, this is, I'll read it as it is. Kwani pitu ni ya nini? Munapata mimba aje? Wow, that is at okay, they have a number for their ex account. So yeah, that was a question that was posed. As you come to a close, they're asking if there's P2, why are people getting pregnant like this?
You know, again, that question deserves a longer answer by a professional gynecologist, perhaps.
Yeah.
But P2 is not supposed to be used routinely. You know, it's an emergency sort of. You know, it's something that kicks in an emergency, and you cannot use it daily. It's not a method of family planning that you want to use routinely because it has its own, you know, broader issues. Yeah.
Last, okay, this one has just pinged. Allow me, please, Timothy. My producer is, we need to wind up, says, baby daddy ameruka mtoi nifanye. Yes, you can tell the people who are actually watching, yeah?
I'm not so sure. Again, I mean, it depends on her situation as a person, yes.
All right.
Yeah.
There you have it. We're going to be continuing to unpack this particular report, especially looking at those gaps that have been highlighted by our guest tonight, that is Kenneth Juma, who is a senior research officer at African Population and Health Research Center. And this is in regard to a report that is already making airwaves since the beginning of this week, just looking at those gaps when it comes to matters of reproductive health. What he has said is that the report did not seek to find out or, you know, bring out that who is conducting, or rather who is undertaking or procuring abortions, whether married or not, but they were just looking at what is happening on ground when it comes to matters of abortion, especially aftercare and such. And take home is that situation when it comes to abortion, the situation is quite fluid, but a recommendation is that we need to retweak our legal mechanisms to ensure that, you know, these procedures are done in a safe and conducive environment. I'm Regina Manyera. My guest has been none other than Kenneth Juma, as I mentioned, the Senior Research Officer at African Population and Health Research Center. I wish you a pleasant week ahead. Have a great night.
Thank you.